Hi, my name is Erica Blaske, and I'm a nurse at the Campus Health Center. Today, we're going to be having a conversation about staying healthy during quarantine. Just some tips to hopefully keep up your level of health while we're all in quarantine for the next few weeks. So, we're going to be talking about today is proper hand washing and social distancing, staying up to date on your vaccines, strengthening your immune system, managing stress, and staying active. So this is Hand Washing 101. Hand washing is about the single most important thing you can do to help reduce the spread of many infectious diseases. Viruses and bacteria can often live on surfaces for several hours. So every time you touch that surface, you can get it on your fingers. And then when you go to touch your face or your eyes, your nose, you can get infected that way. So hands should be washed for 20 seconds, which is about the length of singing happy birthday twice. Another thing you might want to consider is wiping your phone and earbuds with an alcohol wipe once a day, just because it can pick up the bacteria from your hands, and then when you go to put it in your ear or against your face to talk, you can spread the germs that way. And then if soap and water aren't available, soap and water are our number one choice, but if not available, you can use an alcohol-based hand sanitizer, and you can carry that with you in your purse or in your car. So you may have seen this sticker around campus, Warriors Wash Their Hands. You can see the areas that are most often missed, so you'll want to make sure that you are addressing those areas when you're washing your hands. You'll see the 5 steps there that you'll want to take while hand washing. And then I actually, on this next slide, have a quick video for you to watch. You can see the link there if you want to access it again. This is Clean Hands Help Prevent the Flu, which was made by the CDC, but it's really applicable to other types of diseases as well. It's just 60 seconds.
And then spread those germs everything into your hands. You just mix everything and spread those germs everywhere. Focus on sneezing into your elbow like this, and then you don't contaminate your hands. Jump on the bus, wet your hands, letting your hands touch the bathroom, and then focus on washing your hands with the diseases.
Okay, so the 2 things that to especially take away from that video is how she was scrubbing in between her fingers and then under her fingernails, and then also using a cloth to shut off the faucet, so that way your clean hands don't touch the dirty faucet. Now we'll talk about social distancing. Viruses and bacteria can spread more easily when people are in close quarters or when they're standing close by each other, like you see in the photo here. In regards to COVID-19, it is mainly spread through droplets, like when someone coughs, sneezes, or talks. This risk of spread is greatly reduced when people stay greater than 6 feet away from each other, and this is what we call social distancing. A couple other things to keep in mind is you'll want to wear a face cloth cover when you're in an enclosed public building. This will help prevent you from touching your face. It provides a mechanical barrier from you touching something on a shelf, for example, and then touching your face. And it also helps protect others from you in case you are infected with the virus. Studies are now showing that you may be infected and not show symptoms, so that's why it's really important to help stop the spread of the disease that you wear a face cover when you're in public, at least for right now. You're going to want to avoid group gatherings for right now. Also avoiding non-essential travel for right now. You want to stay home as much as possible. You can, like only leaving the house to pick up medications, go to the grocery store, and do outdoor activities. Another thing to keep in mind is that these droplets that we talked about can land on surfaces, and this is what we call fomites, which is a surface that can transmit, that bacteria and virus can live on. So with COVID-19, we have a lot to learn because it is a novel virus about how long it can last on surfaces. So the CDC does recommend that you disinfect your high-touch surfaces daily. This is your doorknobs. This is your cell phone, like we talked about. This is your maybe your toilet flush handle, things that you touch all the time. You're going to want to disinfect daily. Getting vaccinated. So now is not the time to also be worrying about viruses and bacteria that are vaccine preventable when we're focusing so hard on avoiding getting infected with COVID-19. So you can make an appointment at the campus health center to have your immunization records checked. A short list of what you might be due for, at college students are often due for, is annual flu shot, the 4-strain meningitis shot, ACWY, the meningitis B shot, which is a different strain of meningitis than what is in the ACWY, your Tdap booster, which is every 10 years, and then also the human papillomavirus vaccine, which is actually sexually transmitted disease. It can cause genital warts, certain types of cancer, things like that. So super important that you're vaccinated against that. A couple reminders: annual flu shots are free for all Wayne State students at the campus health center. We will bill your insurance if you have it. If not, if your insurance rejects it, or if you don't have insurance, you will not receive a bill. All Wayne State students get one free illness visit per semester at Campus Health Center while they're enrolled as a student. There is currently no vaccine available for COVID-19 as of today when I'm recording this, which is May 13th. We do not have a COVID vaccine. Hopefully one will come down the pike soon. But as of right now, we need to make sure we're protected from as many other types of viruses and bacteria as possible because we don't have time to be sick when we're students. So some tips for keeping your immune system healthy: staying hydrated. The amount of fluids to intake daily varies from person to person. I've been reading a lot of different takes on what is a good amount to reach for. Me, without knowing your kidney history and things like that, I don't want to give a specific number. It's best to talk about with your nutritionist or your primary care provider. But definitely, drink when you're thirsty. Avoiding sugary drinks that include your lattes and your fancy drinks that you can get at coffee shops. It can add a ton of calories to your day. And avoiding excessive caffeine intake. Caffeine definitely is one of those things that can have too much of a good thing. So you just want to make sure that you avoid excessive intake. Good hydration helps the body eliminate waste, lubricate joints, protects tissues, and boosts energy. Your brain is made up of a lot of water, so once you start getting a little dehydrated, that may be the first thing you notice is like foggy thoughts, difficulty concentrating. So drink some water and see if that helps. You're going to want to also get plenty of sleep. Many experts recommend 6 to 10 hours per night. Go to bed and wake up at the same time every day. Keep your body on a schedule. Try turning screens off at least 30 minutes before bedtime to help your mind relax. Lack of sleep can lead to increased depression and anxiety, weight gain, decreased academic performance and concentration, and leads to more frequent illnesses. Also, more tips for keeping a healthy immune system: eating well-balanced meals, focusing on fruits, vegetables, and whole grains, avoiding foods high in saturated fats like high-fat dairy, your cream, your butter, fried foods, and fatty meats, and then again, avoiding excessive intake of sugar. Do not smoke or vape. Here's a phone number here. You can call the Michigan Tobacco Quit Line, which can help provide you resources for quitting. Vaping, there's a lot of science coming out. It's still kind of a new thing that's out there, but you are still inhaling possibly toxic chemicals with vaping, and so vaping is discouraged as well. You're going to want to drink alcohol only in moderation, which is no more than 1 drink per day for women and 2 drinks per day for men. Avoid binge drinking at social events. Hopefully you aren't going to very many large social events right now during quarantine, but just keep in mind for the future. Excessive alcohol use can lead to things like high blood pressure, certain cancers, memory problems, and mental health problems. And the phone number for resources for quitting alcohol, if you are concerned you or a family member or a friend might have a problem, you need some help, 1-800-662-HELP. Managing stress is very important. Stress is a normal physical and psychological reaction to the demands of life. In small amounts, stress can be good, helps motivate people to perform. But what can happen is multiple daily demands can build up on each other and push people beyond their means of coping. So eventually you might reach a threshold where it's too much stress and you can't cope anymore. So here's a few tips that might help you manage your day-to-day stress, which may be higher during times of quarantine. You can call or video chat family at home. Try playing a board game together over the video chat. There's also different apps you can download. You can all play a game together with the app. Mindful meditation. There's a lot of research coming out about the benefits of mindfulness and meditation. You can start by trying to quietly sit for 15 minutes, which can seem like a lot, so maybe start with 5. Focusing on your breath and bringing your mind back to your breathing. If your thoughts stray, that's okay, acknowledge it, but then try and always bring it back to your breath. The Dean of Students office has online activities for you to join. There's a portion on the website called Get Virtually Involved. You might find some activities on there you enjoy. And then don't forget CAPS. You can speak with a counselor for more suggestions on how to decrease stress. So visit their website at caps.wayne.edu. And then some people might find yoga or taking a nature walk as beneficial for decreasing stress. These are still things you can still do in quarantine. You can do yoga in your house. There's free videos online. Nature walks, you can still go outside and take a nature walk even during quarantine. Staying active is very important. Experts recommend at least 150 minutes of moderate aerobic activity per week, but small amounts of activity are helpful and they can add up. So, that means even just a few minutes a day, you do some walking lunges around your room, you go up and down your stairs in your house a few times during the day, maybe you look at the clock and say every hour I'm going to do a minute of jumping jacks. Maybe if you sign on early to a webinar, you're waiting for everyone to sign in, do some wall chair sits against the wall for a few seconds while you're waiting for everyone to sign on. Strength training is also important. All major muscle groups should be done at least twice a week. Proper exercise can boost your mood, fight infection, and lower the risk of heart disease. And by fight infection, I mean help boost your immune system so that it can help fight infection. Mort Harris Recreation Center does have free classes online for students. I put a link there to access the website for that. And then don't forget, many outdoor activities are still allowed with proper social distancing guidelines are in place. Walking through nature trails, as we discussed, golfing, biking, all of that you can still do during quarantine. Just a couple FYI points. We still have our GYT testing days at Campus Health Center. We are open and able to see students for GYT this semester, which is the May 2020 spring and summer semester. We have it on Tuesdays, but that may change. We'll try and keep you posted as best we can on our website if it does change. This is free chlamydia and gonorrhea screening for students under age 24. It's safe, it's confidential. We don't share your results with anybody. And then there's also the Condom Club, which is still available at Campus Health. It's a $5 punch card, which gets you 50 condoms. You can walk in and purchase that card from the front desk staff during business hours. Here's our contact information. You can email us with questions, visit our website. You can send us messages on all of our social media. And we also are now offering telehealth visits through over the phone or over your webcam. So you just call the Campus Health Center at that phone number, 313-577-5041. And then the person who answers the phone will be able to help determine what visit is best for you. So that way we are open for all your healthcare needs during this epidemic. So thank you so much for listening to this. I hope you were able to find some good tips for staying healthy during quarantine, and we hope you stay safe and healthy out there. Thank you.